हे मिनिमाइज केलं. आता केलंय ओपन केलंय तुझ्याकडे आणि माझं डिले चाललंय. मी ऑडिबल आहे? एम आय ऑडिबल? मी तुझ्या मोबाईलवरनं नाही येत ना, म्हणजे स्क्रीनमधनं येते ना माझ्या आवाज? शुड आय स्टार्ट? ओके. हाय, व्हेरी गुड आफ्टरनून. हॅलो. Yeah, hi. Very good afternoon. Let me introduce myself. I am Dr. Aditya Patil. I am a consultant neurosurgeon with specialization in brain tumors. I have done my specialization from Tata Memorial Center. I take this opportunity to thank CARF, Cancer Aid and Research Foundation, for giving me this opportunity to share this short presentation on brain cancer awareness. So, as far as brain tumors are concerned, it is always once if this unfortunate event happens in a family, it is really disturbing for the entire family, and it's one of the most scariest health issue anyone can face in in one lifetime. So let me just go through this presentation, and then we can share questions. Whatever doubts you have, you can ask me. So let's see what is the actually incidence of brain tumors in India. So against the thought that brain tumors are very common, actually brain tumors rank 14th as far as the total number of cancers are concerned. So it is not a very common. Approximately it 5 to 10 people in about a 1 lakh population have brain tumors, and the total number of malignancies each year, if we see the number of tumors as compared to the other cancers, 2.4% of all the malignancies. So it is not that common, but although even if it is relatively rare, the associated morbidity and mortality is very high, and the occurrence is common in young adults and middle-aged individuals. So the overall morbidity and quality of life which is affected is very high. So this is the page I am sharing from directly from the WHO. It is the occurrence of brain cancers according to the Indian Cancer Registry from 2020. And as I told, it is the 14th most common cancer, and it constitutes approximately 2.4% of all the malignancies. But the incidence is not the same. As against the rank 14 in adults or overall rank. Hello. Yeah. So in children, it is actually the second most common cancer after leukemia, and it accounts for approximately 1 out of 4 childhood cancers. So although tumors are rare in children, but still brain tumor is the second most cancer as far as children are considered. So what is a brain tumor? Brain tumor is like any other cancer. It's an abnormal and uncontrolled growth of the cells of brain, and they have if that hit happens, a genetic hit happens, then it is an uncontrolled growth, and the abnormal cells start growing with an abnormal rate, and it forms a tumor. Okay. So basically some unnecessary abnormal cells which are produced, and which the normal brain tissue doesn't require, and then it occupies the space, and that is how a tumor forms. So when we discuss about the age, does the risk increase with the age? The answer is yes, but the risk is mainly for the malignant tumors. The most malignant tumor, brain tumor, is glioblastoma multiforme, and definitely the risk of malignant brain tumor increases with age. And the other type of tumor is the metastatic tumor, metastasis from the other cancers from the body. It spreads to the brain. So that is also one of the most common brain tumors, and the incidence increases with age. But there are, unlike other cancers, in brain there are more than 100 types of brain tumors, and different types of brain tumors show peaks in different age groups. Some tumors like pituitary macroadenomas, they occur in the middle age from 30s to 40s. Some tumors like craniopharyngiomas, they tend to occur in early teens, in young adults. And gliomas, astrocytomas are usually seen after the age of 40. So, what are the causes of brain tumor? And does alcohol or tobacco addiction play a role? So the exact cause of brain tumor is not clear, and there is no evidence that shows a direct association of alcohol or tobacco addiction with brain tumors. Although these addictions don't play a role in brain tumors, but they are of prime concern with other cancers like oral cancers, lung, stomach, and colon cancer. So although they are involved in other cancers, yeah, but in brain tumors there is no direct role. The exact cause is not known. Can the risk of brain tumor be inherited? Yes, in a very small number of cases, there are genetic factors which are involved. So, as you can see in this picture, you might have seen such patients, you might have come across such patients who have multiple small lesions on the face, hands. This is called as neurofibromatosis. And certain types of brain tumors, like especially gliomas or tumors around the optic nerve, they tend to show increasing occurrence in neurofibromatosis. And also some other tumors like gliomas, astrocytomas are common. There are other various syndromes like Liefeld-Romaní syndrome, tuberous sclerosis, von Hippel-Lindau disease, Torcott syndrome. Even in these syndromes, the brain tumor, the occurrence of brain tumor is high. The most important question here: do mobile phones cause brain tumors? There is no concrete evidence yet. There are many studies which are done. Some are contradicting in their opinion. Some say that after 10 years the risk slightly increases. But as far as the multicentric studies which have been done, and there is no concrete evidence, and we are using mobile phones for almost now 25 years, and we haven't seen any specific increase in any type of tumor due to mobile phone use. So now what will come to the symptoms associated with brain tumor. So obviously headache is one of the most common symptoms of brain tumor, but it doesn't mean that each and every headache is because of brain tumor. So if you are having headache, it doesn't mean that you are suffering from brain tumor, unless the headache are severe, persistent, they are recurrent headaches, they are not being controlled by medications, they are worsening day by day. Okay, especially severe in the morning after you get up, associated with other symptoms like vomiting, giddiness, some other symptoms. They are increasing with coughing or any kind of strain. So don't try to treat your headaches with over-the-counter drugs. You should always seek proper professional medical advice and take treatment accordingly. The symptoms in brain tumors actually depend on the site, the location of the tumor, the size of the tumor, and the type of the tumor. Okay. Brain is a very complex structure. Various parts of the brain represent various functions. Like the frontal lobe is the most advanced part of the brain developed in humans. It involves all the thought process, emotions, your behavior, the kind of personality, everything develops due to the frontal lobe. So any tumor which involves the frontal lobe obviously causes some behavioral changes. thought process changes, sleep pattern changes. Okay, memory, it may affect memory, it may affect various factors of your emotion and behavior. Similarly, if it involves a motor strip, that is the center which is important for movements of your body parts, then the patient might present with paralysis or weakness of limbs. So here are various symptoms which are common. For example, projectile vomiting, sudden headache. Headache associated with projectile vomiting, sudden onset vomiting, forceful vomiting, not the vomiting which is associated with nausea, uh, like usually we have in gastric upsets. This vomiting is different. Extreme or sudden drowsiness, tinnitus in ears, some hearing loss, or unexplained seizures, or we say fits, and different languages we call mirgi or fits or seizures. Okay, then other symptoms are loss of balance, numbness or weakness of arms or legs, especially if they are progressive and leading to paralysis of a limb or a side of the body. Changes in personality of behavior, impaired memory or mental ability, problems with speech, again aphasia, problems with writing, drawing, changes in the sleep pattern. There can be various symptoms which can be associated. Now, most of the symptoms are also related to eyes, because the major portion of the eye, except the cornea and the conjunctiva, actually develops from the brain, that is the neural crest. So sudden onset of symptoms like squinting, or what we call it as deviation of the eyeball, sudden deviation, or we call it tirkepana in Marathi, sudden worsening of vision, blurred vision, double vision, or if there is a restricted field of vision, you cannot see the peripheral vision. Such type of symptoms should raise an alarm, and you should definitely seek a medical advice if you have such kind of symptoms. Very rarely there is something called as proptosis which may occur. For example, a tumor which is involving a deep center of the brain which is called as cavernous sinus, and if it causes obstruction of the cavernous sinus, that is the venous flow of the brain, then you might have proptosis also. Sometimes pulsating eyeball bulges and pulsates also with the heartbeat. So even that is seen. So the types of brain tumors, actually broadly brain tumors are divided into two types: primary and metastatic. That is, metastatic is secondary. So primary brain tumors are those which originate from the cells in the brain, and as I told you, there are various types of brain tumors. It is not one or two, there are almost 100 to 120 types of brain tumors. Secondary or metastatic brain tumors, actually the cancer process starts in other parts of the body, and like breast, lungs, kidney, various tissues, and then it spreads to the brain. So metastatic tumors are always cancerous. Metastatic tumors cannot be benign, they are always cancerous. Primary brain tumors can be benign, can be cancerous. Okay, but most of the tumors of brain, so if you say 60% of brain tumors are cancerous, 40% are benign. I'll come to the list in the next slides. So this is a picture showing a different types of tumors as per the area involved. This is the cerebrum, or the we say the bigger part of the brain, and this is the cerebellum, or we say the small brain or chota dimag. And various types of tumors occur according to the site. This is the midbrain. This is the most sensitive structure of the brain. So we get brainstem gliomas, ependymomas in this part, ependymomas, medulloblastomas in small brain. The bigger part of the brain, or cerebrum, we get gliomas, astrocytomas, peanuts, various types of tumors. Okay. These are the most common types of brain tumors. In childhood, they are astrocytomas, medulloblastomas, and ependymomas. Medulloblastomas and ependymomas, they usually occur in the cerebellum. or the small brain. And most common adult tumors, as I said, most common is the metastatic brain tumors, which actually start process in lungs, breast, and other tissues, and then they metastasize through blood in the brain. This is malignant. Then glioblastoma multiforme and astrocytomas, basically they are according to the grades. And glioblastoma multiforme is a grade 4 tumor. It's the most cancerous tumor. And both these tumors are very common. The last which I have written here is meningioma, and meningioma is a benign tumor. Even meningioma is quite common in occurrence. So investigations. As far as investigations are concerned, there are only two things here. It is always diagnosed on imaging, and the best imaging is MRI. So MRI scanning with contrast is a gold standard for diagnosis and further planning and management of brain tumors. We do CT scan only in emergencies when we are suspecting bleed or patient presents with seizures, and we have to see whether there is any bleeding or any other issue. Then we do a CT, but anyways, CT, after doing CT we have to do an MRI to confirm our diagnosis. So what are the treatment options in brain tumors? So as a thumb rule, when we come across brain tumors, we definitely need tissue diagnosis, or we need to excise the tumor to know exactly which type of tumor we are facing. As I told you, there are various types of tumors. So unless and until we excise the tumor, we don't know we are dealing with which kind of tumor, whether we are dealing with a benign tumor or a cancerous tumor. If we are dealing with a cancerous tumor, what is the grade of the tumor? So WHO grades brain tumors in 4 types: grade 1, grade 2, and so on, as per the severity. Grade 1 being the most benign, and grade 4 being most malignant. So grade 1 and grade 2 brain tumors, only surgical excision usually is sufficient. In case of more malignant tumors, that is grade 3 and grade 4 tumors, we have to do a surgical excision, and after surgical excision, we usually refer the patient for radiation therapy and chemotherapy. So the chemotherapy in brain tumors is relatively, I would say, mild, because it usually is given with radiation therapy, and it is called a temozolomide, and it's basically a tablet which you have to take. So unlike chemotherapy for other cancers, the chemotherapy for brain tumors is a bit milder. So the prognosis depends on the grade of the tumor. The lower the grade, better the prognosis. Higher the grade, worst is the prognosis. So grade 4 tumors, that is glioblastoma multiforme, they have a very short median survival, say 15 months to 18 months. Grade 1 tumors like meningioma, once excised, they very rarely recur, and even if they recur, they remain to be benign, and then we can definitely treat them. So when I say surgery of brain, obviously we would think that whether it is safe. Is the brain surgery safe? Yes, as compared to other surgeries, there are more risks involved in brain surgery, but now with advances in technology, the way we operate and the facilities which are available now, brain surgery is definitely, it has become safer. This is a picture I am showing of a microscope. Nowadays we operate under a microscope. All the brain tumors are operated under microscope. This is myself. We are doing this surgery in KJ Somaiya Hospital, and this is a microscope. This is a special neurosurgical microscope. There are various other advanced techniques like this one, which is actually neuro navigation software. So we have neuro navigation software which helps us in localizing the site of the tumor and guides us for planning our craniotomies and surgery. Then we have something which is called as neuro monitoring system. So if you see these wires on the head, basically they are used while doing surgery for monitoring the various aspects, like if you might have heard about the awake craniotomy, then we monitor speech. We also monitor the power, whether after surgery patient will will not lose the power in hands or limbs. So now the brain surgery has become relatively safer. It is not as unsafe or dangerous as it used to be maybe say 50 years back or 40 years back. It is relatively safe now. This is one of the photos which I have taken from my case. You can see this big tumor here. This is a meningioma. I operated 2-3 days back, and this is after the excision, complete excision of the tumor. So now this tumor is a meningioma. It's a benign tumor. So after excision, we don't need to give radiation or chemotherapy, and the patient is treated. Patient is actually ready to discharge in 3 to 4 days. So yeah, so that is it. So that's how brain tumors need to be treated. And yes, thank you for your kind attention. I can take questions now. Whatever doubts you might have, you can definitely ask. Thank you. So here are two questions. There's one question by Ms. Deepika Radhakrishna Hegde. What are the main leading causes of brain cancer? Unfortunately, there is no specific cause of brain cancer as of now. Very rarely they occur with syndromes, as I said, neurofibromatosis, Life-Romani syndrome, Turcot syndrome. But otherwise, brain cancer is 99% incidental. It has no relation with addictions, mobile phone usage, nothing, or maybe lifestyle. It is just incidental. There is no cause of brain tumor which has been really found out. One, you can say that repeated exposure to radiation, yes, maybe, but even that is not proved till date. So what is the next question is by Kokila Shaha, and the question is, what is the most common malignant brain tumor? So the most common malignant brain tumor, I would divide here in two parts. The primary tumor which arises from the brain and is the most common is glioblastoma multiforme. So glioblastoma multiforme is a grade 4 tumor. It is the most malignant tumor, and usually it carries a poor prognosis. As I said, the overall survival rate is between 15 months to 18 months, even after doing surgery, chemotherapy, and radiation. So if you have any more questions, you can ask. So if you have any questions, I can take, or we can close this now.